I was introduced to X39 by one of my patients who was having some really good results with it. She was using X39 and IceWave for dental pain. And when she began to talk about it, I have chronic pain and I wanted to get a chance to try that out, but I was very skeptical, of course. So I began to investigate. Her gynecologist had recommended it. So I touched base with another physician to see what she thought, because she'd been doing it for a while. And so I started it for myself in May. And I just, I love the patches. What more can I say? They're great.
Dr. Patty, let's talk a little more about symptoms of MS and a few of the other patch technologies that you like and why.
Yes, well, I think it's really important to use X39 and X49. Those are always our base, our go-to. And I think the synergy from that to some of the supporting patches is very phenomenal, really. And again, I'm just sharing this with you really today as a patient and sharing with you what I do with my patients. It's sort of a physician, heal yourself, but I'm a patient and a physician. And I hope my suffering and some of my symptoms that are very uncomfortable maybe can be helpful and be of some good and for this world and the glory of God. But I'll be happy to share anything I can. I feel like that for me, one of my biggest symptoms of MS is pain. And it particularly was bad at night. And so when I started in with the patches, I started in with X39 and IceWave, or what I started with. And I was just blown away by the way that IceWave works so effectively. For me, the first night, about 50% of my pain was reduced. And then the second night, I moved it around a little bit. There's great information on site about it. And I moved the patches, did a little differently using a whole body patch approach. And I now have reduced my pain about 80 to 90% at night, which is just incredible and phenomenal. Wow. And I have a news story about shingles, and I'll tell that maybe later if we have time. But I do think that IceWave, because it interrupts that pain signaling pathway, and it works with sort of the white patch and a brown patch. So there's that electrical connection as well, and it interrupts that, and it's just amazing.